Male perineal care. Perineal care involves thorough cleansing of external genitalia and surrounding skin. Articles required: 1 basin, soap solution, wash clothes, 1 jug with warm water, a pair of clean gloves, 1 torch, 1 kidney tray, 1 Macintosh or a plastic sheet, a towel and a top sheet. Greet the patient. Explain the procedure to the patient and take consent. Provide privacy. Wash hands and wear clean gloves. Prepare water to be used for procedure. Test the temperature of water. Assist patient to supine position. Fold top half of the sheet down below the penis position. Cover the chest with a sheet. Keep legs slightly apart. Place a Macintosh and towel below the perineal area. With soap and water, wash patient's upper thighs. Rinse and dry the area thoroughly. Firmly grasp the shaft of penis with gauze piece and retract the foreskin. Assess for signs of inflammation, skin breakdown or infection. Wash with soap and water the top of penis at urethral opening using circular motion from the opening outwards. Discard the washcloth and repeat with clean cloth until penis is clean. Rinse and dry gently. Return foreskin to its original position. With soap and water, wash the shaft of penis with gentle downward strokes. Rinse and dry. With soap and water, cleanse the scrotum. Lift it and wash underlying skin fold. Rinse and dry. Remove Macintosh and towel. Remove gloves. Place the patient in a comfortable position. Document the procedure and findings. This completes the procedure for perineal care in males. Points to remember. Always wash from the pubic area towards the rectum. If the patient has urinary or bowel incontinence, apply a thin layer of skin barrier containing petroleum jelly over the skin. Perineum should be cleaned after each act of urination and defecation. Clean from the cleanest to the less clean area. Hands should be cleaned after giving perineal care.